Okay. So anyway, very good afternoon and happy New Year. Hope all your dreams come true and you practice right homeopathy. Okay. So see, last class we spoke about sarsaparilla. Hope sarsaparilla is clear and the main focus on sarsaparilla was on the urinary tract. We have done sarsaparilla in detail. Okay. So today I'll start with a very new year. Start with a very new remedy. Now, before I introduce this remedy to you, we'll just have a small interaction. A class for final years. We'll have a small interaction and then I'll share or I'll just tell you the remedy that I am going to speak for today. Okay. So a small question for you. If the image is clear and if the voice is clear, if there are no technical issues. Now I've just shown you a small image, a small icon taken from Google Images. Now what I want from you is, I mean, if you interpret the image might look he's in a hurry, he's going to his office. But I have something different. I have something different to ask. And what I'm trying to ask you here is, there are some constitutions. I can share a case. Few years back, I had a person who had come to me for some problem. But then what I found very peculiar in this case was he was some 33 or 32 years old man. He had by then changed some 8 to 10 jobs, 8 to 10 professions. Okay. So my question for you is, who are those constitutions in our materia medica who keep changing occupations? Now, two small things you may have to answer here. Now, when I ask you this question, who are those constitutions who keep changing? The first thing as a homeopathic doctor that should come to our mind is, why is this constitution changing occupations? So the first question is, why a person changes occupation? That is the first question. And the second question is, which are all the remedies as a final year student you can think of? So two small questions. Hope questions are clear. You can use your chat box. You can type, or yeah, somebody straight they came to the remedy. Okay. Yeah, if I'm right, Spurti. Good. Okay. Mahesh says, yeah, Mahesh has an answer. He is answering to this question: why people change occupation? Why people change job? Mahesh says, sir, must be they're insecure. Beautiful. And he also says, must be they get bored. Yeah, two very valid answers. Yes, Mahesh, absolutely right. Any other reasons that you can think of? Okay, there are high expectations from the job. You expect something very high, you are disappointed, you quit. So now what is that expectation? Is the expectation related to money? Is the expectation related to the work? Whatever. So anyway, Vani has got a point. You have some high expectations and then you get disappointed and then you say, no, this is not the job I was looking for, and you quit. Good. Could be those three. Any other I mean, I don't know, because okay, want of power. Spurti says they want power. Good. Okay. So at least yeah, Gautami says they might get discontented. Great. Fine. Okay. Now keeping all these things in mind, if you just see, there are people who might change. This is the commonest scenario we see in the present generation. This office offers you this package, an office offers you a better package, in terms of money, then we keep jumping. So there are few constitutions who change jobs because they are paid better or higher in some other company. So for them, money matters. Okay. So can you think of those constitutions who belong to this category who change jobs because of the financial thing? Which remedies come up here? Very good. I'm not, yeah, good. 1 second, let me, yeah, Nitish, absolutely fine. He says arsenic amal. Good, very good. Good, Nitish, arsenic amal, and then, yeah, 1 second, there are a lot of answers. Calcarea, okay. Nitish again says fluoric acid. We'll come to fluoric acid after some time. Fluoric acid has got a different reason. Arsenic is right, and somebody has written calcarea. 1 second, let me see who it is. Again, Spurti, calcarea, arsenic, okay, are two remedies. I feel you can still think of few more remedies. Calcarea, arsenic, okay. Bhavya says Brainia. Brainia, you all know, is again a money-minded remedy. Now, people, constitutions who change their job because they get a better they get a better package. The first remedy is Naxwamika. And one of your friend has rightly answered, they could be arsenics, they could be veratrum. Veratrum from your second year, they are highly money-minded constitutions. Okay. And sulfur. These are the predominant remedies. Okay. Now the other reason why somebody might jump from one job to another job. Now this is a very different scenario. I'm talking to you here is a man might keep changing jobs because the job that he is working, he feels there's a lot of injustice happening. Okay. And he can't tolerate that injustice. He quarrels with the management. Naturally, when you don't have a good relationship with the management, with the higher ups, working there will become very difficult. So, any wild guess who is this constitution who keeps? Yeah, very good. Yeah, I mean, good. I'm happy. Nitish, answer is absolutely right. The remedy is causticum. Good. The remedy is causticum. So, causticum constitutions, they keep changing jobs because they will not tolerate any injustice happening. Good. Now, the third thing here is, now this is the case I just shared with you. This gentleman almost changed some 10 to 11 jobs, and in the end he decided I can't work under anybody, and he started his own firm. This gentleman was very haughty, very egoistic. When any of his higher ups would tell him something, he would feel, why, who is he, why is he telling all these things to me? Okay. So this gentleman beautifully improved with platina. So people who change jobs because of ego clash, because of haughtiness, you have a series of remedies coming up. Lycopodium, veratrum, sulfur, and platina. So when a person changes a job, the first question is, why is he changing? And accordingly, we can decide the remedies. Now, somebody rightly answered, I don't remember the name. If I'm right, it should be Spurti. She was talking of a constitution changing jobs because for him position matters. Okay. And in our materia medica, which is that constitution for whom position matters? The constitution for whom position matters is lycopodium. Absolutely right. Good. Lycopodium. Lycopodium people, they change because for them position is very, very important. Okay. So we'll go ahead and we'll also see if you remember somebody had answered fluoric acid. Can somebody quickly tell me why fluoric acid keeps changing jobs? You have already given me the answer. You said they get bored. Yes, absolutely right. They get bored. And fluoric acid will not like to stay in a firm in a place for a long period. Right? It applies in fluoric acid to various things. It could be girlfriends, it could be car, it could be house, it could be any damn thing. They get bored very easily. Fine. So fluoric acid is a constitution who like challenges. Once he is in a firm and the firm comes up to certain level, he gets bored with that job. He wants to look out for some other firm, some other job. Now that is fluoric acid. So people who change jobs, in their term they say, I don't get kick anymore. This job is not exciting anymore. This job is not challenging anymore. And they quit. They go to some other job. That is fluoric acid. So as a final year student, next few years you'll become intern. I thought you should know a person coming to us changing jobs. You can think of these remedies, and the list can go on. See, today's remedy. When I said changing occupation, I don't remember the name. One of the student rightly guessed the remedy that we are going to discuss today is Sanicula. See, officially in your repertory, Sanicula is the only remedy which is mentioned under occupation changes constantly. The only remedy we have is Sanicula. Now, why Sanicula keeps changing occupation? Okay. See, the previous remedies we spoke, they had some solid purpose why they are changing the jobs. Sanicula is a constitution or is a person who has no stability, instability of purpose. If you get a constitution, if you get a patient tomorrow in your clinic who is changing jobs and he has no motto or he has no aim or he has no intention why he is changing jobs. In such constitution, if other symptoms agree, you can think of Sanicula. So next few minutes, we will try to understand Sanicula. What is Sanicula? What is Sanicula made up of? Who was the physician who accidentally proved Sanicula? Where exactly Sanicula acts? Find the sphere of action. What are all the ailments of Sanicula? And if time permits, we will quickly look at the mind or the mental symptoms of Sanicula. There are few students, for some reason, they have joined late. For those students, anyway, I'll unlock. Yeah, for those students, so that we have a continuity, what we are trying to do is we have started a new remedy, and the remedy is Sanicula. And before introducing Sanicula, I had just shared few clinical tips why different constitutions they change their occupations, and we had a very healthy discussion. So we'll talk of Sanicula. Now, Sanicula, from your pharmacy knowledge, you know that it is prepared from the spring water of Ottawa. Okay. Now, this spring, uh, you know, it gets the name Sanicula, and the spring water is collected in a place which is located in United States. and it was accidentally proved by one doctor, Dr. Gundlach, and I was just reading it on the net a few minutes back that he and his family drank this mineral water for almost a year, and they come up with lot of symptoms. Fine. So he makes a note of whatever symptoms his family comes up after drinking the spring water or the mineral water for almost a year. Okay, and it was proved somewhere in the year 1890. See, when I said mineral water or the spring water, and in that article he mentions what spring water is all. So we'll not go into the details of all those things, but you need to understand that Sanicula, the spring water, has lot of other minerals in them. Okay, now this is a very important point because as we progress further and understand the drug picture, you will see that it has got a lot of symptoms similar to other remedies. Now, why they have the similarity is because this mineral water has other substances like natriumur. You also have calcarea sulf, calcarea carb, magnesium mure, alumina, and silicia, to name the few. So this is a very important slide. Now, what is this slide telling us is that Sanicula, the spring water, the mineral water, has lot of minerals, and to name few, we have these minerals. It's very important. Now, because Sanicula has these minerals, when you read the drug picture of Sanicula, you will get a feeling that I'm reading some symptoms of graphites here. I'm reading some symptoms of borax here, or natrium, silicia, or calcarea. So this, the mix or why you get the feeling is because Sanicula has all these minerals present in them. Okay. Any quick questions here? I know. I mean, the only disadvantage of an online class is, no eye contact. Really, we don't understand what is happening the other side. Okay. Hope it is clear. Yes. Okay. So if things are clear, we'll go ahead and we'll look at the very important aspect of Sanicula. It is a very deep acting remedy. It is a polycrust remedy. It's a constitutional remedy. Where exactly you see Sanicula acting? See, when I use the word constitution, when I use the word polycrust, it acts from head to toe. But in today's class, we are focusing mainly on the predominant areas Sanicula acts. See, you have calcarea in it, you have natrium in it. Now, what exactly gets affected in Sanicula is the nutrition. I'll again talk about this a little later. This is also a remedy which has an affinity for the GI. And again, in the next class, when I'm talking to you about the gastric symptoms, you will realize that Sanicula acting on the gastric system, it will cause slow digestion. Naturally, when the digestion becomes slow, it will give rise to indigestion. Slow digestion mainly in children, especially infants. They have problems digesting milk. You see infants vomiting milk. What other remedies come to our mind? Infants vomiting milk. Are you all there? Yeah, very good. Yeah, I mean, if you don't answer, yeah, very good. I'm happy you're all there. Yeah, Yetusa. Good. Ethusa antimonium prudum. Yeah, good, very good. Or few remedies which can also have issues with digestion of milk. So indigestion, constipation on GI, very important is its action on the female genitalia. So the uterine ligaments, the uterine muscles become weak, and one very important remedy for uterine prolapse. Okay. The last thing, it also acts on the neck, and one more area is the skin. It can cause a lot of eruptions on skin. We'll look at it. Now, very important will be appearance. See, if you, that's why I gave a pause and I told you I'll be discussing the nutritional part a little later. See, when you look at the physical appearance of Sanicula, predominantly a child remedy, but it acts beautifully well both in men and women. Okay. Now, can somebody quickly describe the image? How is the child looking? Yes, very good. The child looks emaciated. The child looks malnourished. Beautiful. What other remedies come to your mind? Yeah. Which are the other remedies that come to your mind? Very good. As a final year student, abrotinum. Okay. Any other remedies? Children who look thin, emaciated, malnourished, abrotinum. You should also think of argentum. Okay. Argentum, lycopodium. There are a list of remedies. Opium, syphilinum. Okay. Yes, good. Silesia, tuberculinum. Hmm? Are few remedies that you can think of. Now here, the description of this particular physical constitution is like this. You know, many of the things you have covered, you have told emaciated, you have used the word malnourished, fine, and wrinkled, skin is wrinkled, and they hang in folds, very characteristic of Sanicula. Skin malnourished, wrinkled, and they hang in folds. So this is the typical appearance of a Sanicula child. Okay. Now, what are all the ailments of Sanicula? Hmm? We have only three ailments. I was referring a lot of books. What I could get here is jarring. Ailments from jarring. Okay. One. And ailments from strain. Strain. Ailments from strain. Jarring, strain, and strain could be emotional and strain could be physical strain. So when you look at emotional strain, you have mainly ailments which comes from worries. Ailments which comes from worries. So three important ailments you have to remember. One is jarring, then strain, and then worries. Okay. So a small recap. Sanicula Aqua is the remedy we are discussing, and I gave you what all Sanicula has. Okay. And second thing we discussed the sphere of action. Third is the physical appearance, the ailments, and we come to the last component of today's class, and this is the mentals of Sanicula. I'll just show you three images. You have one, two, and you have three images. So kindly interpret. Yeah, I mean, one of your friend has also told iodine for this thing. What is it? The physical appearance. Absolutely right. Absolutely right. Very good. Iodine. And the images. A lot of people interpreting the images. Yes, very good. Stubborn, obstinate, angry, cranky. Good. cross, good, irritable, beautiful. I'm happy. And now this is the beauty of learning through images, thanks to Google Images. Right? Okay. Yeah. We'll get back. You're absolutely right. Now, what remedies come to your mind? And say, I've been always insisting the pediatric group that we have in our clinic, and majority of our homeopathic practice is, at least some 60 to 50% their pediatric group. So understanding the pediatric group is very important. Okay. Now, who are those children? Who are the other constitution child remedies that you can think of when you see these images? Yeah, good. Very good. Yeah, I mean, the common, child remedies. Very good. See, to top the list here will be Sina. Good, agreed. Sina, chamomilla, only Sina and chamomilla. Yeah, creosote. Good, agreed. I mean, you can think of some better remedies. Uh, See, and the beauty is, after you give the right homeopathic medicine. Yesterday we had a case of a very young boy, 20, 20 or 20 months, not years, I'm talking of months, 20 months old boy. The first sitting, there are a lot of issues, very angry, he would bite himself, fine, and he was badly constipated, very irritable child, absolutely no appetite. Done. Now, after you give a right homeopathic remedy, mind you, if the remedy is right, it will be music to your ears to listen to the follow. Intelligent mother, father, keen observers, they can give you beautiful follow. See, the follow-up will be beautiful only if your remedy is right. If your remedy is wrong, please don't expect a very nice follow-up. If your remedy is right now, a lot of things can happen. The child that I was talking to yesterday, he was very hyper, very cranky, angry, biting himself, a lot of things. I had prescribed him Tarantula hispanica, and the follow-up yesterday was very encouraging. He has calmed down, he's not all that angry, appetite is better, and he had a lot of issues with his hair. Hair was not growing. And dad had shown me an image of his hair being very, very thin. And after Tarantula, he's got nice hair. So what I was trying to tell you is the pediatric group, they contribute to our homeopathic practice. So uh, take them into, take it seriously, understand the child, understand the materia medica, and if you can do the right matching, similia similibus curanter, you can do wonders. So as majority of you have observed, these kind of children, we think of Sina, we think of chamomilla, tuberculin. You can also think of Hyos, Verat, Antim crude, again a very important remedy. So from what you have described, what I was just reading in the chat box, what you need to understand here is Sanicula, the Sanicula child is very obstinate. They're very touchy kids. See, many times the same picture we would have given Sina, we would have given Chamomilla, and we would have failed. Okay. Now, at least through this class, you need to understand that there is also a remedy called Sanicula, which can have a similar picture. Right? Children who are very touchy, they will not allow you to touch them. Forget about touching. Somewhere I have written, they will not even allow to look at you. And in such cases, I have used Sina. I have never used Sanicula. I have used Sina in my clinic with beautiful results. They'll not like to be touched. They'll not what uh, allow you to look into their eyes. I mean, they are very cranky kids. Sinar does wonders. Okay, angry, irritable, and fear of downward movement. Now, why did fear of downward movement come here? Can somebody quickly recall and let me know? Why did fear of downward movement come up here? You will have to go back to the, yeah, beautiful, Kuldeep, beautiful, good. I mean, the beauty is I like the speed. You just ask the question immediately. The answer is typed. Good, keep it up. Borax. If you remember that first slide, I told you, Sanicula, the mineral water has lot of other minerals, and one such thing we spoke was it also has borax. And very strongly seen in provings, very strongly observed in our clinical practice is Borax child. Beautifully, it is given in Kent's, Farrington. When the child is, I don't use the word drop down, when the child is slowly placed into the cradle, the downward movement, the child starts crying. When you're lifting is fine, but even when he's sleeping, when you're planning to place him down, he can start crying. So strong fear of downward movement is there in borax. Good. So we'll go ahead and we'll also see that they will continue with the Sanicula child who is very cross, who cries, kicks, they want to be carried, doesn't like to be looked at. So these are few more things you have in Sanicula child. And of course, another very important thing is you have an alternating state. Now, what is that alternating state you have in Sanicula is the child is cross, meaning the child is irritable, cranky, and he quickly alternates with laughter and he becomes playful. I hope you are getting the situation here. The child is cranky, irritable, but he can quickly start laughing and start playing, meaning an alternating state where an irritable child can quickly go into laughter, cheerfulness, and playfulness. So this is a PQRS we have in Sanicula child. Hope this slide of Sanicula is clear. Hmm? Okay. So if it is clear, what we'll do is there are few more symptoms, and in the end we'll try to sum up. Sanicula has calcarea, fine, and what you see in Sanicula is they are very timid constitutions. They're very fearful constitutions. What fear Sanicula has? Okay, what is the fear that Sanicula has? Any wild guess? What are the fears of Sanicula? Please think of the other minerals. Yeah, Alia says darkness. Good. Yes, it has got fear of darkness. But please think of the other minerals Sanicula has. That will give you a small clue. Darkness, yes, it's there. I can show you. It is there. Only darkness. Okay, now I show you something and then you'll start answering better. Now, Sanicula, yeah, Pragati has got it right. Sanicula has fear of robbers. Okay. Now, why fear of robbers? Question is, in Sanicula proving, why do you see why do you see fear of robbers? Okay, security, sir. Fine, more than security. Agreed. Yeah. The answer is Sanicula has. Yeah, I don't know who has answered it. 1 second. Let me give credit. Yeah, Manjunath. Manjunath, and must be one more person. some issues with the, yeah. At least Manjunath Reddy's name, I can see it here. And if I'm right, Ananya, I'm not very sure. So two of your friends get it right. And Sanicula has a good amount of natrium. And in the next class, when I talk to you about the characteristic symptoms, you will see a lot of net-term symptoms coming up. Okay, so fear of robbers, absolutely right. And Alia was talking of fear of dark. Yeah, you have fear of darkness, calcarea, and another fear you also have in Sanicula is fear of something might happen, something bad will happen. So fear of misfortune, something bad happening, fear of misfortune. And yeah, plenty of fears. I've just named few. Fear of downward movement, which I did mention under Sanicula child. Okay, these are few fears, prominent fears you have in Sanicula. So going ahead, the last part here is, see from this slide, what you see is Sanicula patient, they constantly keep looking back. Now, why do they keep looking back? Right? Now, I was referring the repertory, and there is a delusion. Now, what is the delusion Sanicula has? A strong delusion Sanicula has is they feel somebody is following them. Okay, they feel somebody is, yeah, good. Naveen also has got it right. He's talking of fear, but I've gone ahead and I'm talking of delusion. Constant, irresistible desire to look behind. See how nicely it is given in the provings in our Materia Medica. Constant, it is not desire, irresistible desire, meaning this turning back is not under his control. Now, why is he looking back? Why is he turning back? Is because he's got a feeling that he has been followed. So, constant, irresistible desire to look behind because he feels he's been followed. This is what you have in Sanicula. And one peculiar thing in Sanicula is they have dreams of robbers. Now, dreams of robbers is not peculiar. I use the word one peculiar thing. What is that that is peculiar in Sanicula is that dreams of robbers to the extent that the patient wakes up and searches for the robbers. You should remember this. Luckily, I had one or two cases. I have not used Sanicula, but one or two cases where this situation was so prominent. Husband would tell, "Sir, she gets up and she says robbers are there, and she keeps checking the entire house." So the dreams are the fear of robbers to the extent the patient checks the house. You have only two remedies. Okay, you have only two remedies in our Materia Medica. One I have already given you, and I assume, yeah, see, before the remedy, I mean, see, that's the beauty. Uh, I'm happy to have, yeah, I mean, see, even for a teacher, if the teacher gets a good set of students, I mean, it's worth it. Beautiful, good. Pragati, before I completed the question, the answer is ready. The answer is Netremure. Netremure, good. So Netremure is the only other remedy, and the remedy that I have used in one or two cases in my clinical experience, where I have given to patients who have this strong fear or a dream of robbers, and they are not convinced till the entire house is searched. Only after searching the house, they go back to sleep. Netremure and Sanicula, two remedies. Okay, beautiful, good. So, yeah, I mean, there's a small text coming up. Yeah, dreams of robbers. fear of robbers, and searches the house. Okay, so this is with Sanicula. We have 3 more minutes, and we can make use of this 3 minutes. We'll try to recall, or if you have any questions, we can take up the questions. Now, before I take up the questions, if at all you have any, uh, to sum up, we started a very important remedy, Sanicula, and what are the other minerals that we have in Sanicula was the first part. And when you read Sanicula, you will get a feeling that there are some symptoms of some other remedies mentioned. So you might get a feeling of borax, you might get a feeling of calcarea, you might get a feeling of thuja. That looking back, is very, very strongly seen in thuja constitution. Okay, or you might get a feeling of magnesiums. I'll discuss in the next class. And of course, that Sina, Chamomilla, that obstinate, cross, cranky, irritable kids. Fine. So that is what you'll be getting. So to revise, it had three very important ailments. What were the ailments? Yeah, can somebody quickly type or tell so that I feel convinced that the effort of good jarring, absolutely right. Then second one was, what was the second ailment? Caring worries strains. Good. Yeah, good, beautiful. And the characteristic mentals of a Sanicula child. What were the characteristic mentals? Child was, I know you are typing good. Yeah, child was obstinate and taciturn, fine, cranky, good. That alternating state from being cross, irritable to being cheerful and playful. Yeah, very touchy, good, agreed. Doesn't like to be touched, doesn't like to be looked at. Okay, and what were the areas where Sanicul acts? Sphere of action. Sphere of action is mainly JAT, good. JAT, the nutritional thing, the nutritive thing, skin, and yeah, uterus, female genitalia. Very good. Okay. So, any questions? Any quick questions? See, next class, hopefully, we will have another online class, and I intend to finish Sanicula. I'll not typically go from head to toe, but then I have listed some 10 points, and these 10 points will cover the entire uh, gist of Sanicula. Hopefully, I'll be doing it in the next class. Okay. Chalo, thank you for joining in, and once again, a very happy and prosperous new year. Thank you.
Thank you, sir.
1 second, there's a question. 1 second. Yeah, what was the question? I don't know. Somebody had typed why Sanicula. What was it? 1 second. Let me just say. Can somebody read this question, or can somebody type it again? I mean, I don't know. I saw a question going up. Yeah, it should be Alia if I'm right. Constantly, yeah, see, must be Alia joined the class late. We discussed this part that why the Sanicula patient keeps changing his occupation constantly. We saw that these are the people, I mean, if you want, I can just show it. These are the people who have no aim, goal, and if you ask why they change, they have no proper answer that they can give you. So there is instability of the purpose, meaning why they keep changing. There is no solid intention, or there is no solid goal. Like for example, if you see here, they all had some intention. They had, they all had some goal. And if you see here, That goal is missing in Sanicula. So a constitution who just keeps changing and has no solid explanation why it's changing can be more of a Sanicula. Hope Alia's question is answered. Any more questions? Okay, if there are no questions, thank you for joining, and next class we'll take up the remaining part of Sanicula. Thank you.